Hello guys, nice to see you again. Let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Today's lesson 67, normal chest x-ray, made easy for nurses, part 1. This is made for the hard-working nurses all over the world in the hospital. Let's go. As you see, this chest radiograph is a healthy young man without abnormal findings, so-called normal chest X-ray. We have to think about 4 things in this chapter. First, what's normal? Second, chest X-ray means with 3D thorax organs expressed in 2D simple plain X-ray image. 3. White, dense areas are X-ray attenuating, more observing organs such as heart or bone, and black, thin areas are lung or air, which means they attenuate less X-ray, less observing organs. And 4. Let's get familiar with normal chest X-ray image. That means we should memorize the normal image in our brain. What is our first impression with these 2 films? They are made with the same X-ray tube and same human body. Left side is thorax, right side is long bone. Why we feel difficulty on the chest radiograph? Because there are many overlapped organs on the chest radiograph with many disease conditions. But on the right side, long bone only shows bone, and muscles, tendons, skins are not important on that right side image. That's easy to interpret. So, with the chest radiograph, I'll explain important thing first and easily and simply, and then you and I need to get familiar with chest radiograph, normal chest radiograph. Let's first start with a large airway. On your right side, we see black image of large airway from the CT data, and we can see the same large airway on the left side normal chest radiograph. You see? Slowly pay attention to the large airway on your left side normal chest X-ray. Magnify the view. Now we see more clearly on the left film the normal large airway of black color on the right side. Number 1 is trachea. Number 2 is right main bronchus. Please focus on the left side normal chest radiograph. Number 3 represents right upper lobe bronchus. Number 4, right bronchus intermedius. It divides into right middle lobe and right lower lobe bronchus. You see the normal large airway on the chest radiograph on the left side. And number 5, left main bronchus. It divides into left upper lobe bronchus and left lower lobe bronchus. Now we are familiar with large airway on the chest radiograph. Let's move to mediastinal margin on the left side. We have to focus on our eyes on the left side chest radiograph of normal young woman. Number 1 is left subclavian artery. We see this left subclavian artery on the left side chest radiograph, right? Number 2, aortic arch. Number 3, left pulmonary trunk. Number 4, it is flat, it is normal. Left atrial appendage. Number 5, as we see, left ventricle. Now it's time for right side mediastinal margin. This is normal chest radiograph of a young man. Number 1, right brachiocephalic vein. It goes into superior vena cava of number 2. It goes into right heart border, right atrium of number 3. Let's move to lower side, abdominal side. The arrow indicates the uppermost margin of both diaphragm, not whole diaphragm, just uppermost part of the diaphragm. It may be said as horizon. Below that diaphragm margin, there are also both lower lobe of the lungs. And please look at the right side. What do we see? What do we include below the diaphragm margin? On your right side, liver, inferior vena cava over hepatic vein, and gas-filled, food-filled stomach, and then spleen on the left side of the wall. Let's make it clear again about the mediastinal margin. On the left side from above, left subclavian artery, aortic arch, left pulmonary trunk, left atrial appendage, left ventricle. Right side from above, right brachiocephalic vein, superior vena cava, right atrium, inferior vena cava or hepatic vein. Now with this lady's normal chest radiograph, we see 1. Large airway. 2. Left border of mediastinum. 3. Right border of mediastinum. 4. Upper abdominal organs. Let's move to pulmonary arteries, maybe the hilum. On your right side, MR angiogram, we see the right, number 1, and left, number 2, pulmonary arteries. Normally, usually, left pulmonary artery is higher than right pulmonary artery. That's why we see on normal chest radiograph on your left side, left hilum is higher than right hilum. That means left pulmonary artery is located higher than right pulmonary artery. Pulmonary veins and left atrium. These organs are usually not clearly defined, not clearly visible on the normal chest radiographs. That's why we are not so familiar with the pulmonary veins and left atrium. On your right side, that is CT angiogram of pulmonary venogram. In the center, it is left atrium. On the four corners, there is a right superior pulmonary vein, right inferior pulmonary vein, left superior pulmonary vein, and left inferior pulmonary vein. They are represented on your left side normal chest radiograph. When we are evaluating pulmonary veins and left atrium, we need imagination that these organs should be there. I see you are there. Let's move to the normal peripheral lung. Subscribed and good. Gracias. Thank you very much. In the peripheral lung field, we not only have lung tissues, alveolar tissues, but also have pulmonary arteries and pulmonary veins. Most of the densities in the peripheral lung are from pulmonary artery and veins, not from pulmonary airways. On your right side, these are MR angiogram of pulmonary arteries and veins. As you see, number 1 represents right pulmonary artery, number 2 means left pulmonary artery. Please focus on the right side film of left side of the patient. Normal healthy young man's left lung on the right side film. Number 2 represents left pulmonary artery. And now we see more clearly about the left pulmonary artery and left pulmonary vein on this peripheral lung field of normal chest radiograph. How about the normal healthy young man's right side peripheral lung field? Please focus on the pulmonary arteries and pulmonary veins on the right side of a young man's normal chest X-ray. Now we see more about the pulmonary vessels on the normal chest radiograph. For better interpretation and proper diagnosis with the chest radiograph, we have to turn it back from two-dimensional X-ray film into 3D original human thorax data. So we need imagination and jigsaw puzzle solution. It's bonus time. Let's talk about the left lateral film. The left lateral film is not so important than as we need before. Left lateral film is taken, as you see on your left side in this mechanism, from the X-ray beam through right chest, mediastinum, and through left chest, and then film or detector. That's left lateral film. So that's why the L of blue color of left diaphragm is higher than the right diaphragm on the lateral film, and yellow L of left breast is smaller, clear margin with denser density. On the left side film, we see two dark black triangular areas. One is named retrosternal triangle, the other is retrocardiac triangle. One is behind the sternum and the other is behind the heart. These two triangular areas contain no important organs, so they should be look black, dark. If they contain something, then it becomes white, dense. It means there are pathologic lesions there. Now we are almost there. What do we need to enjoy the chest radiographs? First, at least we should know some anatomic knowledge. And second, let's get familiar, get used to the normal chest radiographic film. And most importantly, we need imagination to make 2D film into 3D original structure. Now I see more with this film. Now we see more with this young lady's film. Thank you for watching. Next time, let's move to the abnormal findings, part 2. See you. Bye-bye.